Can you guess what this is? And no, it's not a grape growing out of your vagina. I'm Dr. Tanny Brown. I'm a urogynecologist, which is also known as a reconstructive pelvic surgeon. And let's talk about this thing over here. So this is a condition called a urethral diverticulum. It's a pouch or a little pocket that forms along the urethra, which is the tube that carries pee out of the body. There are different theories about why this happens. Some people think it's a result of repeated infections and scarring in that area in the tube. When someone has a urethral diverticulum, there are a couple of symptoms that they may have. The most obvious one is someone may go to their gynecologist or their primary care doctor and get a pelvic exam, and here's this thing right there. Other symptoms that somebody may have if they have this condition: pain with sex, or dribbling after they pee. Some people may actually have stress incontinence, meaning leakage when they cough, laugh, or sneeze, repeated urinary tract infections, or UTIs. About 20% of people who have a urethral diverticulum actually have no symptoms at all. What do we do about this? Surgery is typically the most common treatment. This is an outpatient surgery where we make an incision along this little pouch and peel this pouch out, close it up. Because this pouch communicates with the urethra after surgery, it's not uncommon that somebody has to have a catheter in place for an extended period of time, typically 7 to 10 days. Recovery after this is pretty smooth and simple, other than usually having a catheter in place. Now you may say, well, what if I don't want surgery? That is an option for people who have no symptoms at all. They're not bothered by this. Maybe they didn't even know it was there. There is an option to watch this. If someone has chosen to observe this or watch this, we usually recommend seeing your urogynecologist often to keep an eye on this, because in very rare cases, a cancer can grow in this urethral diverticulum. But again, this is not common. Oh, and I should have said this, urethral diverticulums are not a super common condition, so I don't want you guys just checking your vagina to see if you have this thing. But if you feel something in the vagina, an anterior mass, it's important to see your doctor so that you can be examined to make sure that it's not this, but any other condition that could present like an anterior vaginal mass. Share, like, and follow along. Bye.